people ask, what is neurofeedback? They typically want to know how you do it, what it helps, and how it's different than other options. With neurofeedback, anyone can improve their brain. We've trained children, teenagers, and adults from age 2 to 92. For children, it's often used for ADHD, emotional and behavioral issues, learning and developmental delays, and struggles in school. For adults, it's commonly used for anxiety, depression, obsessing, and sleep problems. Neurofeedback measures brain activity, like brainwaves, and it helps you make more or less of certain brain patterns. By changing brain activity, or by changing how one area of the brain talks to another, you can improve attention, control of your emotions, and behavior. There's research on how it helps migraines, pain, concussions, addiction, and seizures. But what do all these have in common? They're brain issues. With neurofeedback, your brain changes itself. And when it does, typically any of these issues improve. It's not all about problems. Neurofeedback improves performance by changing the timing of the brain. That can help anyone in performing in school, business, or sports. It helps give you an edge. Neurofeedback is different from brain games like Lumosity or tutoring or therapy. Those focus on changing your skills or behavior or how you think. Neurofeedback is focused on changing the brain. There are parts of your brain that help you pay attention, that help you be calm, that help manage your mood and your emotions, or that help you sleep. You don't realize how much your brain affects your mind. With neurofeedback, you get to see how changing your brain can have a huge impact on your life. How do you do neurofeedback? First, we put sensors on your head. Commonly, we measure your EEG brain activity with a special computerized system. The system gives you feedback, such as playing a movie or hearing a beep. For example, when you make a certain amount of beta brain waves, the movie will play perfectly. But as soon as you're less alert and awake, the movie starts to fade out. You rapidly learn how to keep the movie from fading out by changing the brain activity that's being trained. Your brain has a way of figuring out how to get the movie to play. Once you learn new patterns, and that may take practice, your brain tends to remember it. There's a lot of published research that shows that the brain learns from feedback and that measurable changes in brain activity occur after training. So how do you change your brain? It's just learning. Children learn to play a video game, and they never read a manual. Their brain figures it out. How do you balance on a bike and not fall over? Somebody probably showed you, but it's your brain that figured out how to balance. When you train brain activity, your brain figures out how to balance its own activity. So once you train the brain, does it stick? Well, you don't forget how to ride a bike, even if you hadn't ridden in 10 years. It's the same with neurofeedback. Once your brain learns, you don't tend to forget it. There are exceptions, particularly if there's disease like Alzheimer's or neurological issues, but there are still ways to train your brain. The changes you make with neurofeedback can over time have a profound effect on learning, memory, attention, mood, migraines, and far more.
Hey guys, I'm Robert. I used to have ADHD. I don't have ADHD anymore, and I'm making this video to tell you guys about this really cool treatment called neurofeedback that really changed my life, and I just want to tell you my story. ADHD is the brain having a physical disability to choose what it pays attention to. If you're in a classroom, classrooms are noisy. There are kids on one side having a discussion, the air conditioner is whirring, and when the teacher's talking, you can't choose to pay attention to that teacher over the conversation that's happening on the far right of the room, over the noise of the air conditioner over the noise of the kid next to you tapping his feet. You don't get to choose. Whatever is the loudest is what you pay attention to. You kind of hear everything at the same time. I spent the first 17 years of my life getting about 10% of the things people were saying to me and filling in the other 90%. And the problem with that primarily, other than the fact that you're missing information, is it makes it really hard to relate to people because you can't hear what they're saying to you. And that leads to social anxiety because no one will really ever respond positively to you when they feel like you're not listening to them. ADHD stems from having about 60% of the dopamine of a normal person. And dopamine is your brain's chemical reward system. And your brain wants to have enough dopamine all the time. So when someone with ADHD tries to do something boring, their brain simply doesn't have enough reward for them to keep doing it. And so parents of people with ADHD will often point out that their kid can game for 6 hours at a time and can't do 6 minutes of math homework. And that's because that kid is searching for something that'll release the gap in dopamine between an ADHD brain and a normal brain. And gaming releases that extra dopamine and math doesn't. So kids with ADHD can really only do the things they love for that reason. ADHD makes something that's so simple as making a bed feel emotionally overwhelming because ADHD makes it impossible to connect problems to their solutions with steps in your head. So making a bed, pretty simple process, take off the top sheets, take off the pillows, put on the sheet, put on a blanket, put the pillows back on, you're done. But that's 4 or 5 steps, and when you have ADHD, it's impossible to do that in your head. So you look at a bed and you think, oh my God, how do I put that together? And feels like the task will never end, and so you just don't do it. Because ADHD makes it to where you can't really think things through, the only way you have to think about things is what feels good probably is good. You can't think about the consequences, you go with your feelings. So when I had ADHD and someone came up to me and said, hey, it's a Wednesday night, why don't we go get drunk? I'd say yes, because I wasn't thinking, hey, tomorrow's Thursday, I have a test, I probably won't want to be hungover for it. I was just thinking, hey, getting drunk feels good, let's do that. I was diagnosed with ADHD by basically by going into a doctor and telling him that I had ADHD. He just kind of believed me. There was no real diagnostic test or anything. But basically, I went into a doctor, told him I had ADHD. First thing he did was hand me a prescription for Vyvanse, which if you don't know what Vyvanse is, it's a very powerful amphetamine. It's basically a little bit milder form of meth. Vyvanse, for lack of better terminology, stole my soul, temporarily at least while I was on it. It made me feel extremely wooden, dead, and boring, and so I started doing a lot of other drugs, drinking, in order to level it out. So in a very real way, Vyvanse was my gateway drug. Vyvanse also skyrocketed my social anxiety and made me not feel like myself. And I guess I started thinking, why does my doctor really know what's best for me? He's not in my own head, I am. So I started playing around with a lot of other drugs to try and figure out what molecules would make me feel best. I'd been prescribed Vyvanse by a man in a white lab coat. I'd already been told that I was better off on drugs than off of drugs. I figured I'll figure out what drugs are best for me. To give you an idea of how bad it got, how bad it can get, for a while I was taking Valium and smoking weed and going to school, and that's kind of how I went through life. There's really a solid 3-month spot in my memory that's mostly blank just from drug use. I used to procrastinate a lot. I'd always put work off to the very last minute, and I was told I was really lazy for this all the time, but it wasn't out of laziness, or at least it wasn't out of laziness intentionally. My personal theory is that I would procrastinate because when I procrastinated, I was put in a position where I was afraid I was going to fail if I didn't do the work immediately. And it released a lot of adrenaline out of fear in my brain, and that adrenaline kind of acted as an ADHD medication. So I know people with ADHD, they procrastinate a lot, and I just wanted to say it's not a character defect. It's the brain looking to manage its own ADHD in the best way possible. I used to have to lie a lot just to get through my day, just to keep people off my back, because I had always forgotten to do something. And the lies were never malicious, and they were never too far off from what I intended to be the truth. For example, if I'd forgotten to do an English essay, my English teacher would ask me, "Robert, do you have your essay with you today?" And I'd say, no, I'm sorry, I did it, I forgot it, I left it at home on my desk, I'll bring it in tomorrow. And the thought in my mind was, I'm gonna go home and immediately do that, and then I'd walk out the door and see something shiny and completely forget about it. So I'd end up lying all the time just to keep people off my back, because I couldn't really get through my day another way. So for a long time, I was really sure that I wasn't going to be able to go a day in my life without being high from the time I woke up to the time I went to sleep. And so when my mom said, we should take you for neurofeedback, I thought, I guess this couldn't hurt, but I really didn't think it would do all that much. But now I'm happy in my own head, and it really changed my life. The biggest change I've seen since I started doing neurofeedback regarding ADHD is now when I talk to someone, I hear everything they say to me. When someone is talking to me, I don't know, if you don't have ADHD, that doesn't seem remarkable at all, but to those of you with ADHD, it was just it's really an amazing feeling to have someone talk to you and hear every word that they're saying and be able to engage in a conversation with them. Because I can hear what people are saying to me now, I've started getting positive feedback in conversations, and because I started getting positive feedback, my social anxiety has gone away, and I'm much more comfortable just being who I am. Neurofeedback is like a cheat code to life, because it makes me so able to handle the adverse events that happen on a daily basis. When things happen that used to make me upset and used to make me freak out, I stay calm through them, and I'm able to handle them.
So you brought in Jonathan to get some help with what at our office?
With focusing, paying attention to detail, and then also being not as squirmy, or being able to sit still and and just.
Okay. And then how long had he been having problems with these things, and how old is he now?
He is 14, almost 15. He'll be 15 in December. And he has been struggling with this since he's been a toddler.
Oh, wow. It's a long time then.
A long time, yes.
And you've used medications.
Yes.
But Jonathan didn't really want to use them.
No. He didn't understand it at first.
Right.
But once he did understand what he was taking, because eventually he asked, what is this? Is this a vitamin? Is this...
Right.
Because they're learning about drugs in school. And then once he realized what it was, and then he would question, why don't I have to take it this day? And it became easier to explain to him that we don't want him to be on the medicine at all times, because we need his body to take a break.
Right.
And we need him to be able to just let it out of his system so he doesn't get addicted to it.
And then Jonathan is on the autism spectrum disorder
Correct.
path. So he's a high functioning,
Very high functioning. Yes.
Asperger-ish
Correct.
kind of fella.
Correct.
And we've just completed the first few, how many sessions of neurofeedback?
Probably 13, 14
13
sessions,
or 14, okay.
Because we just did the...
We did a remap, and we had about a 14% change.
Yes.
And then you told me that there was some really nice changes that you've seen. So can you recount those again?
Sure. One of the first things is that Jonathan pays attention to the time. He knows when he needs to come and do his homework. He doesn't need constant reminding to sit down and do it, or he's not complaining that he can't focus on it.
Right.
He actually comes down, sits down, and works on it and gets it done. The other thing that he's very much in tune with the other treatments and things that he needs to do on a daily basis in order to continue with his studies. And I was going to remind him, and I didn't need to, because he came into the room and said, I know it's time for me to do my next treatment.
That's cool.
So, yes.
So you said before you'd have to remind him to do his homework too, but he'd said he noticed he wasn't as focused.
Yes.
And so
he couldn't even sit down and concentrate. He knew that he wasn't focusing.
Right.
And so he would have to get up. He would ask for music to be played or some other thing to keep him from being so distracted. Now he can sit. People can talk. His brothers can talk to him, and he will still be able. He'll tell them to go away because I need to focus on my homework.
Nice.
Yeah.
So now one of his goals was to start this school year without
medication.
ADD, ADHD medication.
Correct.
And so he did that.
Yes.
And he's
successful. Right now he is saying that he's telling us he feels more focused now than even when he was on the medication.
Beautiful.
So that is a huge improvement. We are so proud of him. And the other aspect that I wanted to touch on too is his eye contact and the type of conversations that we're having with him.
Right.
And what he's having with other people. His grandparents absolutely noticed the difference in him as well.
Yeah, because we noticed that pretty rapidly when he started coming here. It didn't take long for the eye contact to get much better.
Correct.
And for him to start carrying on some conversations with us even.
Correct. Oh, good.
Yeah.
Yes, good. Yes.
So that's good. So happy so far?
Yeah, very happy.
Hello Brains! Izza, aka Superbrain, asked if I could do a video focusing on ADHD in girls. Of course I can, Izza! In fact, let's play a game. Find the kid with ADHD. This one's a no-brainer, right? Well, you know what I mean. But did you notice the girl brain staring out the window? How about the one still working on her test long after everyone else is finished? If you didn't, you're not alone. Boys are diagnosed with ADHD 3 to 4 times as often as girls are, even though research is starting to show that girls are just as likely to have it. In fact, some experts believe that boys are being overdiagnosed while girls tend to be underdiagnosed. Why is that? The simple answer? It's complicated. I did a ton of research on the issue and I found 5 main reasons for this. 1. Stereotypes. Boys tend to have the hyperactivity form of ADHD, which is what we tend to think of when we think of ADHD. Since most research, literature, pop culture focuses primarily on how ADHD expresses itself in males, most people are more familiar with what ADHD looks like in males. The less girls fit into that stereotype, the less likely it is that they'll be recognized and diagnosed. 2. The squeaky wheel gets the grease. Boys with ADHD tend to cause more trouble, so parents and teachers are more likely to look for a solution. Girls tend to have the inattentive form of ADHD. On progress reports, they're the well-behaved, bright students that just need to try harder. Even the girls who are hyperactive tend to try to work harder to be good and fit in than their male counterparts do, probably due to societal pressure. 3. Clinical bias. Even if a girl does stand out enough to be referred to a mental health professional, she's less likely to be diagnosed with ADHD than a boy is, even if she has the exact same symptoms. 4. Girls are more mature. Actually, girls just mature faster than boys do. There is a definite correlation between maturity and likelihood of diagnosis. Studies have shown that children young for their grade level are more likely to be recognized and diagnosed. Since girls tend to mature faster than boys, they're more likely to be missed. 5. ADHD comes with friends, and not the good kind. 40% of those with ADHD also have a learning disability, such as dyslexia, and 75 to 80% of kids with ADHD will develop a second or even third psychiatric condition at some point in their lives, which makes things really messy and hard to diagnose even for experts. That's true for both genders, but girls are 3 times more likely than boys are to be treated for depression before they're ever diagnosed with ADHD. So, despite what pop culture would have us believe, ADHD is not a one-size-fits-all stereotype that's easy to spot. So, as teachers, coaches, parents, friends, how do we know what to look for? Well, it helps to understand what ADHD usually looks like in girls and how that differs from what it looks like in boys. Before I get started, A, I'm not a doctor, you probably know that by now, and B, these are generalizations. Not every boy or girl will behave this way, but they tend to. Boys get in trouble a lot at school and work. Girls tend to have more difficulty in social relationships and at home. Boys are usually more physically aggressive, shoving, hitting, kicking. Girls are usually more verbally aggressive. Boys' symptoms are more external. Girls' symptoms are more internal. Boys often interrupt while other people are talking. Girls space out while other people are talking. What were you saying 5 minutes ago? Boys externalize their frustrations. Girls tend to turn pain and anger inward. Boys are more likely to have behavioral issues. Girls are more likely to suffer from low self-esteem, anxiety, and depression. Remember, these are generalizations. This is not going to be true for everybody, and there's going to be exceptions. In fact, boys with the inattentive form of ADHD also tend to get overlooked. And even boys with hyperactivity can easily be dismissed as just boys being boys. In both boys and girls, it's important to recognize and treat ADHD as soon as possible. Early treatment can not only help manage symptoms now, but help prevent other disorders from developing in the future. I posted some great additional resources in the description below. Please share this video with teachers, coaches, parents, anybody that you think might be in a position to recognize and help a kid who is still struggling. That's it for this week. Thanks, Izza, for your great topic suggestion. If any of you would like to suggest a topic, hit me up on Facebook or Twitter or comment below, and be sure to subscribe so you will see it when I make it. Bye, brains!
You're beautiful. All right, so you went to a conference.
Second semester conference, which most people do not go to. Their children, you only go if your child needs help or there's a problem. So I'm used to going to these every year for Alyssa. And this time and I said, Mark, this is the band conference. And we walked in and the teacher said, you guys didn't need to come to this one, but we wanted to come so that we could celebrate together. We wanted to tell you how awesome Alyssa's doing, and it was rave reviews. She went from 1s and 2s to 2s and 3s. All her stuff improved. Awesome. I mean, it's great, isn't it?
What's she been doing to get that kind of result?
Gluten-free and Dr. Johnson's awesome neurofeedback and Nate.
Wow. So you're pleased with that?
We are so happy.
Awesome.
He's awesome.
Awesome sauce,
so I
as
wrote
we
on
say.
Facebook so everybody could see, and I wanted everybody to know how happy I was.
Good, thanks. That's fantastic.
Oh, goodness.
Mostly that. So, Miss Nancy, we had done some neurofeedback over the course of the last few weeks, right?
Yes.
And we were just having an interview about your most recent brain map, and you were discussing with me how you're feeling. I was wondering if you could just tell the folks here on camera what you were telling me about what you've noticed.
I have noticed I'm less anxious. I am more concentrated. I can read, and I can stay focused on a project that I'm doing better than. I used to get distracted, so I can do that better now, stay focused.
Good.
And as I told you, I believe I can go back to college again now.
Good.
I want to
Because
get
there
that
was a
degree.
challenge with that, right? You
There
were
was
having
a-
some issues.
I did have some issues, but I can modify my needs right now. I maybe don't have to go into the hard sciences and can just maybe do something that doesn't put that kind of pressure on me.
Right.
So I believe I'm capable of going back to school again.
Awesome.
And
That's
that
really,
makes me very happy.
I would think so.
Yes.
So how did you find the neurofeedback experience here at the office? What did you notice, how was it? Was it easy to do? Was
Oh.
it comfortable? Was it,
Without a doubt. Yeah. They put a little goop on my ear, put the electrodes on my forehead and my ears, and I sit down and enjoy a flick that I like watching.
there you go. And
Yeah,
then
it's
and your
easy.
brain trains. And then the movie kind of fades in and out. And
It does.
did you notice that as you went along with your sessions, that you got less fading in and out over time?
I did.
Yeah.
I noticed that. And at one time, it wasn't fading in and out at all.
Right.
I had to make sure that it was the correct process that we were doing there.
Right. So what happened, in reality, what was going on is that you were training so well that you were getting into that groove of what the program was wanting to do, is to, whatever it was set for, you were actually accomplishing. Kind of like riding a bike and not falling over.
Yes. Yeah.
It's like, oh, I'm riding my bike. This
I mean,
is
it's-
good. And I feel good. I'm riding my bike.
It's just
and that's
painless. Frankly,
Yeah.
it's painless.
good.
And it works.
Excellent. Thank you very much.
Thank you.
And congratulations. This is a set of parents who are here for a progress interview after second brain map. And we noticed about a 27% improvement in the overall changes. And then we asked about how you felt as far as, from your perspective, how your son was doing relative to the challenges he was having. So what are some of the issues that you saw that improved?
Well, we were talking about the biggest problems we noticed last year was in school. And after school, he would get home around 4 o'clock, and he would have 2 to 5 pages of homework that he would bring home, and it was a struggle from 4 o'clock all the way to his bedtime at 8, and he would cry through it and not get any of it done. But I was saying that I've noticed recently that he's come home with 1 page of math homework that he's able to sit and finish in 5 to 10 minutes. So it's been a huge improvement with his schoolwork.
And no more tears?
Not at all.
Not at all.
And then part of what we do is we use neurofeedback with neurointegration through the Clear Mind system. We change diet. We get rid of some foods that tend to cause challenges with the gut and brain, like gluten and dairy and so forth. And then at some point in time, we try and reintroduce some things back, see if we can be less limited. So you noticed something when you reintroduced mozzarella cheese. What happened?
As taking the foods away was a struggle, obviously, at 7 years old, but as we reintroduced the food, he would just take anything, kind of plow through anything we gave him, till we started with mozzarella cheese, starting with dairy. After about 3 or 4 days, he had a horrible problem with it. He had some bathroom issues, and my wife was talking to the teacher at school and even had some noticeable concentration issues with the reintroduction of that. So that has been the only thing we've had problems with.
So you said something, the teacher said there was a homework project. It was 3 weeks,
Yeah.
given for 3 weeks to get done?
Yeah, it took them 3 weeks to get a writing project done after the reintroduction of mozzarella cheese, even though we took it away.
Yeah.
It was 3 weeks
Took
to get this
3
writing-
weeks to get
to
things.
get this writing project done.
That's how important diet is to gut and then brain function.
Yeah.
Absolutely.
So so far happy with the program?
Very happy.
Oh, very much so.
We've noticed so many changes along the way that it's been great. I mean, we're always nervous at first because we're sort of lost in what direction to go, but after we've gone through the program, what we've noticed with them has been huge.
Beautiful. Well, we're really happy to be part of the success. Thank you.
Thank you.
So what's your first name?
Thomas.
So Thomas, you came in here because your parents, these guys over here, they wanted you to come in and get some help. What were you having problems with when you first came here?
Focus.
Yeah. How was it doing homework?
Hard.
Yeah. And did it take a long time?
Very.
Did you not finish it?
Yes.
Yeah. So, but now you're doing a lot better, right?
Mm-hmm.
So, how do you feel about that?
I'm happy about it.
That's awesome. That's a great thing to say. So, and is school a little bit easier for you?
Mm-hmm.
Yeah. And then it's more fun going to school when you have a better time at it.
Mm-hmm.
Yeah. So good. So we want you to be one of our people on our success wall with your picture and on a plaque like that. What do you think about that? Is that a good idea?
Mm-hmm.
Okay, cool. Thanks. All right, hi. So can you tell us who you are?
Hi, my name is Alex. I just got my piano performance degree at Oakland University.
That's awesome. I know I got to see your recital, and it blew my mind.
Yes.
It really did. Tell us how many pages of like music you memorized.
If I counted correctly, I think it was 135.
I mean, that's to me is amazing. So you came to us because we had some issues with a few things we had, and maybe you can tell us what they were.
Well, I would usually have like brain fog. I would be able to walk down the hall and I wouldn't know how I got there or got to the end of the hall. I wouldn't know why I came exactly. Ever since I had the neurofeedback, that pretty much has gone completely out the window.
Good.
You actually also had trouble, despite having 135 pages of memorized music, it took far more effort than it should have to memorize most of those pages. Usually, I would have no trouble retaining most of the stuff I memorized, but it was a workout trying to keep all that. I started the neurofeedback, and since then I've been able to find even more methods for memorizing music. So,
So you found easier ways to do it, or more efficient ways, or
yeah, kind of a mixture of both. Alternative ways too. Depends on the kinds of music, even.
Right.
So don't want to get too in depth.
All kinds of strategies.
Tons of new strategies. Yeah.
Oh,
so
that's good. So would you say the problem that you had some ADD maybe?
Yes. Oh, for sure.
Yeah.
Definitely.
And so some of the things that we use neurofeedback to help with that, which helps improve brain function. It's like exercise for the brain. And then we also had you change your diet to get rid of certain substances. What were those?
Particularly gluten.
Gluten,
was
yes.
the biggest one.
So, but you did notice a change after you did that. I remember you told me, you said, man, I remember.
I remember one time I did eat gluten after that, and I could feel the difference tremendous, and that was not good. That was not that was horrible.
And the reason that happens is when you're eating gluten consistently, which most people do, your immune system actually gets its function degraded, and then when you get rid of it, the immune system gets a chance to rebuild itself. And then if you either accidentally or on purpose have some gluten, it lets you know about it right away. But if before you kind of felt yucky anyway all the time in certain ways, whether it's brain fog or whether it's GI complaints or other symptoms, and then you have it and then bam, you have these pretty significant symptoms. That's what most of our patients tell me. And then they really, really, really know without me telling them that, they should not be eating gluten.
A lot more energy pretty much the whole time. And then I had the gluten that day. It was a mess. So, yeah.
All right, great. So, I appreciate you taking the time. And what would you recommend if someone else had some issues with ADD or ADHD? Do you think maybe this might be a good solution for them?
Oh, definitely. It's helped tremendously. I mean, I'm only halfway through my treatments, I think like 15 in or so, and I've already seen a huge difference. So,
good.
Yeah, I would say for sure.
Well, thanks for sharing.
No problem.
So, who do we have with us today?
My name is Stephanie, and I have struggled with ADD symptoms pretty much my whole life. It's really all I've ever known. My symptoms primarily consisted of me having an inability to maintain focus, and not really in the sense of, me needing to go from one task to another because I got bored. It was more like I would miss bits and pieces, and I would kind of like spot out from time to time, you could say.
Can you give us like an example?
Yeah, absolutely. If someone's telling me a whole bunch of things at once, I know that I'm going to like miss a couple things. Like most times I'm going to end up missing at least little bits and pieces. So I always have to like try really hard to focus, and then usually make sure that like kind of check to make sure I didn't miss anything. It was just like a normal part of my daily life.
So what is it like to, like, can you, when you were having problems with that, could you have listening to someone and write something at the same time? Was that trouble?
No, that was another big issue for me, was multitasking. It was pretty much not an option for me. Whenever I tried to write things down, talk at the same time, or write things down and listen at the same time, I would end up screwing one of the two up. I also would go into like an autopilot or like zoning out mode very easily. Like autopilot meaning I could be doing one thing and my mind was accidentally completely elsewhere, or zoning out where I just accidentally slip into a daydream without even realizing it, and I'm missing information that's coming at me, whether it be if I'm talking to someone or if I'm supposed to be doing something.
Wow.
Yeah.
So what kinds of things were you trying to do to get help for those types of inattentive issues?
Medications, which were extremely effective for me. I've been prescribed pretty much every ADD medication under the sun, and while some of them were extremely effective for me, they all came with adverse side effects, including nasty energy crashes at the end of the day, and as the medication wore off, just my mood would plummet, my irritability would go sky high, and I didn't like feeling like a pill was dictating my energy and my moods.
Ah, okay. So how would you say that your life was impacted on, like, besides work? Is there other things that would happen?
Yeah, absolutely. So, I mean, simply things like talking to my husband, I would miss part of what he's saying, and I'm so sorry, I accidentally zoned out, I wasn't listening to you, but it's not because I don't care, which is really hard for people to understand that don't have ADD. They think you're not listening because you don't care, but it's truly just, it's accidental. You can't control it all the time, even though, no matter how hard you try.
So that could create a little bit of friction here and there.
Yeah, absolutely.
Like, what?
Yeah, exactly. Yeah.
All right. So then how did you learn about our office and what we do?
I learned actually about you guys when I was driving by, and I saw that there was a nutritional chiropractic or a nutritionist chiropractic, and I was like, what is that? And I didn't even realize that and then I looked it up online, and I saw that Dr. Karl treats a whole bunch of different neurological disorders, and I was very excited to see that there were testimonials and things like that for treating ADD, because as far as I had known, this was only something that could be managed with medications, and I had kissed the thought of even getting rid of my ADD completely goodbye. I never thought that was an option.
So we did an exam. We found out some areas of trouble.
Yes.
Did a brain map, and then we found out, oh yes, we have some abnormal brainwave activity. So we engaged in brainwave neurofeedback, which is right, EEG biofeedback, also known as neurofeedback, neurotherapy, brainwave biofeedback, however you want to call it. And at first, you didn't notice much.
Right. At first, well, it's as I progressed into the treatment, that's when I really started to notice the changes, which is what I was told ahead of time as well. And then the changes started happening, where all of a sudden I was at work and I noticed I'm multitasking effortlessly. And the first couple times that happened, those were really big moments for me. I was writing things, doing my assessments at work. I was writing things down and listening at the same time, and completely doing both efficiently. And that's never been something that I can easily do, let alone correctly do it. And then I also noticed that I wasn't zoning out or going into my autopilot modes anymore. I was just present all the time, which sounds silly, but that in itself has been a very big gift for me. I haven't lived a life like that.
Yeah.
I've also noticed that I don't blank out on words anymore. I used to constantly whatchamacallit or thingamajig, like those were normal words that I would use because it took too much energy for me and time to think of the right words, so those were just my replacement words. Now I don't notice that happening nearly as often, only when I'm really tired, which I think is normal.
Yep.
And let's see, I also, yeah.
No, that's why I was going to say that besides neurofeedback, we did some things with nutrition.
Yes.
What did we find out?
Well, I noticed that my energy levels went up from that, and I didn't have any big aches and pains before, but all of my aches and pains that I did have, like pretty consistently in my knees and my legs and things like that, completely gone as I progressed in that
So you just
treatment.
thought that was like normal living.
Yeah.
I'm just getting older. It's just
Exactly.
everybody complains of the same
Right,
thing.
and other people have really big, severe chronic pain, so I'm lucky to only have, a level 1 or 2 or 3 of pain. That's no big deal. I shouldn't even worry about it. But now I know it's an option to actually not have any aches and pains, just based
Right.
on my diet and the inflammation that my diet can cause.
So did you have an interesting experience when you included certain things that we found that you shouldn't have in your diet? Did it create a problem for you recently?
Yes, it did. So gluten, I found out that I'm extremely gluten intolerant. And when I decided to have some pancakes, and I thought those would just be some innocent pancakes, they had wheat in them, which contains gluten, and my symptoms skyrocketed again. And I had no idea that gluten could possibly impact my brain function to that level. It was very, very severe.
Yeah, and then you noticed a difference during a neurofeedback session, because when you start neurofeedback, part of what you do is any kind of biofeedback, you're taking something you can't feel, in this case brainwaves, and making you aware of them. In this case, we're watching a movie. The movie plays normally when your brainwaves are doing what they're supposed to, but when they're out of the normal mode that we're trying to get them toward, then the movie will pause or dim, and the sound in your headphones will diminish. And so you were noticing that as time went on with your sessions, that was getting more consistent with the movie playing more normal. And then one time, after you had the gluten, you said, oh my gosh.
Yeah, the TV was constantly dimming down, the volume was constantly going quiet, and I was like trying to focus so hard on watching, like maybe if I just focus a little bit harder, like it'll stop dimming and the volume will stop going down. And it wouldn't stop, it was just going the whole time. And my brain waves I saw were just they weren't the way they were supposed to be based on what Dr. Karl had showed me before.
Right. So then once you emailed me and said, hey, what's going on? What happened with my session? And then you had already said that you had eaten gluten, and so I showed you some research about how there's a connection between brain inflammation, and that's likely what happened because your slow wave activity went way up.
Exactly.
And so, any other interesting aha moments other than the cool multitasking thing that you've noticed?
Well, I've noticed a very big difference in my increased ability to organize my thoughts and effectively articulate myself. Before, I had the knowledge in there, but organizing my thoughts and being able to communicate them effectively was a little bit of a struggle for me at times, especially without medications. But now it's much more easy for me. I've noticed a big difference with that.
Superb. So, what would you say to some other folks that maybe are struggling, they don't know that there's any other way besides medication?
I would highly recommend coming to Dr. Karl's office and giving neurofeedback and the nutrition program a try, because it's been life-changing for me. I almost on a daily basis will just think about how everything is so different now and how I'm able to think so much more clearly, and I get teared up. It's embarrassing to say, but I get teared up because I'm just so grateful for my newfound concentration and ability to focus. So I highly recommend anyone that is struggling with ADD, ADHD symptoms to come and give Dr. Karl a try.
Yeah, I appreciate hearing that, because there's a lot of people that think it's only for kids or
Right.
adults can't benefit, but absolutely, you've had problems for a long, long time, and you've been on medications for a long, long time, and that makes a really good point too, by the way, is that when your brain starts working better, the side effects of the medication can increase, and that's when you know it's time to
Start going down.
diminish them.
Yeah.
And then, of course, we send you to your doctor to make sure they do that with you, since that's not our place to change medications.
Right, of course.
But anything else you'd like to share?
No, just one last big thank you to Dr. Karl and your team. I am forever grateful for everything you've done for me.
Well, thanks. We really appreciate hearing it, and I know this will help a lot of people.